You know, there's a huge problem hiding in plain sight in modern healthcare. We have these incredible, truly life-saving treatments for the sickest heart patients, but so many of them never actually get them in time. So in this explainer, we're going to dig into why this deadly gap exists, and more importantly, how we can fix it, all based on a new scientific statement from the European Journal of Heart Failure.
And the scale of this, well, it's just staggering. 15 million. That is how many people are living with heart failure right now across Europe and North America alone. It's a massive public health issue, and for way too many of these folks, the disease is going to progress to its absolute most severe stage.
And this really gets to the heart of the conflict. The paper puts it pretty bluntly. Any delay in getting these patients to the right specialists, well, it contributes to worse outcomes and missed opportunities. So it's this race against the clock, but it feels like the system itself is putting up roadblocks. Okay, so let's dive into this. Let's really investigate this deadly disconnect. We've got to understand exactly what's at stake when a patient with advanced heart failure gets referred too late or, not at all.
And believe me, the stakes could not be higher. For a patient who's only getting standard medical therapy, their one-year survival rate is basically a coin flip. It's around 50%. But if they get advanced therapies, like a heart transplant or a mechanical pump, that number just skyrockets to nearly 90%. This isn't just, a small improvement. We're literally talking about the difference between life and death for so many people.
So you're probably thinking, why is there a delay? And the first major hurdle is something you might not expect. It's what we can call a knowledge gap. It's kind of surprising, but even really experienced cardiologists can struggle to pinpoint these super high-risk patients early enough on their journey. So what even is advanced heart failure? It's not just a slightly worse version of the condition. We're talking about the most severe stage, where people have these awful, debilitating symptoms that just won't go away even when they're on all the best medications. Their bodies are basically fighting a battle they can't win on their own.
So, this is the million-dollar question, right? How can doctors actually spot this earlier, before things get critical? The good news is, there are tools designed to do exactly that.
Well, one of the best tools out there is actually a pretty clever mnemonic. I need help. Think of it as a powerful checklist of clinical red flags, like H for repeated hospitalizations. It's designed to be a quick signal that tells a doctor, hey, this patient needs a specialist, and they need one right now.
But here's the kicker. Even with simple tools like I need help and official definitions from all the big medical societies, a recent survey found that less than half of cardiologists are actually using these official criteria in their daily work. That just shows a massive disconnect between the knowledge we have and how it's being used.
Okay, so it's not just about what individual doctors know or don't know. Even when a patient is flagged correctly, the healthcare system itself, it can throw up some serious roadblocks. This is what we'll call the system gap. I mean, just think about this for a second. Nearly 1 in 5 cardiologists says they find it difficult or very difficult to get their sickest patients to the specialized centers that can actually save them. The system should be a direct path to care, but for too many, it feels like an obstacle course. So what's the solution? Well, one popular idea is to create a more integrated system, something people call the hub and spoke model. Basically, you have these elite national centers, those are the hubs, that do transplants and mechanical support. And they're connected to specialized district hospitals and local community centers, the spokes. It creates this clear, collaborative network so that patients get exactly the right level of care at exactly the right time.
All right, but there's a third gap, and honestly, this one might be the most fascinating of all. Let's call it the human gap. This is all about the deep psychological disconnect that can happen between a patient and the reality of how sick they actually are.
Just look at this perception gap. It is huge. One study found that while doctors classified 69% of their patients as high risk, only 14%, just 14% of those same patients saw themselves that way. And you can see how that would lead someone to delay or maybe even refuse a referral for care that could save their life. And this isn't some rare thing, We're talking about nearly 3 out of every 4 cases where the patient and their doctor have completely different ideas about the patient's prognosis. They're not even on the same page, which makes trying to make decisions together pretty much impossible. And when you look at the absolute sickest patients, we're talking people with less than a year to live, the communication breakdown is just, it's almost total. Fewer than 5% of them were both aware of their prognosis and agreed with their doctor's assessment. That is a massive failure right when communication matters most. Okay,
So we've laid out these three huge gaps: knowledge, the system, and the human element. It sounds pretty bleak, right? But what's the path forward? How do we start building bridges to get people better care?
Well, the good news is the solutions line up perfectly with the problems we've identified. We need to actually use simple screening tools like that I Need Help checklist. We need to build out those integrated hub-and-spoke networks. We've got to improve education for both doctors and patients with a real focus on better communication. And of course, we need policies at a system level that actually pay for and reward this kind of teamwork.
So, why does all this matter so much? Why is it so absolutely critical that we get this right? Well, it's because getting these referrals right, it doesn't just tweak the process, it completely changes a person's entire future. Let's look at the actual outcomes.
So we already saw that incredible jump in 1 year's survival. But let's look further out. At 5 years, survival on medical therapy alone is very, very low. But it's around 60% with a mechanical pump and 75% with a transplant. And look, it's not just about living longer. Check out the quality of life and return to work rows. The improvement is just dramatic. Bridging this referral gap isn't just about extending life, it's about restoring it.
So, in the end, fixing this problem is about more than just new science or better checklists. It really demands a whole new way of thinking about healthcare. And it leaves all of us with a really important question to ask. Is your healthcare system built for collaboration, or is it built for silos? Because the answer to that question could be a matter of life and death.